Hello, welcome to the AT and Osteo Chronicles. My name is Brynn Bicknell, and I'm a certified athletic therapist.
Hi, and my name is Jenna Howe. I'm an osteopathic manual practitioner, and we're here to take a dive into the world of manual therapy, rehabilitation, and everything in between.
Yes, today we have a special guest, Heather, who is a registered acupuncturist and is sharing her unique perspective on concussion recovery.
Yes, I'm super stoked. I've been wanting to have Heather on for ages. So my introduction to Heather was years ago when we started to just co-manage the same patients. And so in my practice, if I keep hearing a name over and over again, I pay attention and I save that name so that when somebody asks me, hey, do you know an acupuncturist? I can say, well, actually, I know quite a few people who have worked with Heather over at X Place, and it's gone, it goes really well. Feedback is really fantastic. And so I've been kind of following Heather along over the past few years. And also I'm also super biased because she's now my acupuncturist and she keeps me together. It's amazing. So lots of bias, but um, Heather is a licensed acupuncturist who specializes in neurological conditions, including post-concussion syndrome and whiplash and everything that goes along with MVA. And if I remember correctly, Heather, there was a conversation we had when you said, "Ooh, I love MVAs."
I know it sounds really bad, doesn't it?
It's
I'm just gonna,
fantastic.
for people out there that don't know what MVA is, it's a motor vehicle accident.
Yes. Post-car accident is um, such a unique moment for the system because it's dysregulated in such a particular way from the impact and the surprise that acupuncture in the really early days after the experience is, I think, and again, I'm really biased too, but I think it's the best treatment style that you can do because it's so gentle for the nervous system. So it allows you to integrate everything that's sort of been shaken like a snow globe and you're still a little bit like not landed back in your body. Acupuncture has this amazing ability to help people take that deep breath and then be settled in their recovery process. So I honestly want everybody after a car accident to see an acupuncturist a couple of times. But
Yeah, and I find like with the work that Bryn and I do, it's very similar um in its concept in terms of it's very gentle on the body. It helps to rebalance the nervous system after that big shock. And I do find that one of the few modalities that actually pairs really nicely with what we do is acupuncture because it's not really aggressive on the system. Sometimes what people will, if they'll see a chiro or massage, it can be just a bit aggressive when the nervous system is still really fragile. Whereas I find what we do and acupuncture has a really nice commingling where they're instead of bouncing off of one another, they really just help each other move along. And so that's what I've been, it was a pleasant surprise years ago to be able to witness that, but also really fantastic to be able to provide one more avenue for the person that I'm working with to feel better.
mm-hmm. Yeah, it's such a an important settling to happen first because I find that when I see people much later in their trajectory and they've done other modalities, there's sometimes like a plateau that hits. And it's I think for me, because that dysregulation right at the beginning wasn't in that gentle way, like really held and left space for. And I know that all acupuncturists are different, as are osteopaths, as are athletic therapists, I imagine. And so the way that I practice is always like if points are uncomfortable or there's something that's bordering on like I can't relax with that, I adjust it and I take it out. So I do have a gentleness built in with like surrounding the needling and the points. Um, and I know that acupuncturists have different styles. And so, you do have to sort of make sure that you find the right fit. But especially in that window when everything is so activated, I find that that tenderness and gentleness really helps people just sort of like come back to the present moment.
Yeah, I would have to agree with you on that. I find that some people do too much in the
Yeah.
beginning where they're
Yeah.
trying to get as much help as possible so they can recover quicker.
Hmm.
But in doing so, they're actually overwhelming their body and they're not allowing it to kind of settle. It's almost like the inflammation process, and we're trying to stop it and have it reverse before things can get worse. But then they just pile on everything and it just cascades it further.
Exactly. And I think it's the data that I was seeing is it's something like 2 to 3 weeks that soft tissue injuries emerge after a car accident. And so it doesn't even present itself as a symptom. And so if you're going in and getting more vigorous manual therapy or moving too intensely on an exercise route, you don't even get the signal of, oh, this is too much because it hasn't even emerged within your sensations yet. And so yeah, that window, I've had clients call me like day of their car accident and I'm like, great, come in and like let's just get you settled. And it can vary between a really relaxing session to quite a like coming out of a sense of shock as well. And so there's a bit of wiggle room for everybody's system to regulate in the way that they're going to. But once they leave it, they're like, oh, yeah, okay, there I am. And then they go home, and then, their symptoms are going to emerge as they're going to through the next couple of weeks. But we can definitely manage um, the extent of the discomfort, I think, in that time frame with that more restrained approach in the beginning.
Yeah, for sure. Um, and it's interesting too because in some of the osteopathic training, um, you don't even touch like the brachial plexus for 6 weeks
Right.
because if the nerves have been stretched or damaged or whatever it is.
Yeah.
So anything that is going to be too vigorous on the neck
Yeah.
can be really tricky. And um, I've definitely been in situations where even the lightest little bit of work on the neck can be provoking.
Yeah.
And so learning to pull back, work on a different area, honor where they're at. Each person has their own different experience as well. Um, I did a webinar, I don't know, years ago on Eastern philosophy and post-concussion. I'm just wondering if there's a traditional Chinese medicine perspective on post-concussion. Is that even a thing in traditional Chinese medicine, or I don't know.
I think so within traditional Chinese medicine, so TCM, there's a bunch of different schools of thought and approaches. And so I can think of two right off the top of my head that in one school that's a little bit more, I'd say classic and traditional for what we learn here, um, that there's a lot of descriptive syndrome patterns that are describing like how the energy flow gets disorganized. And so it sort of covers the realm of the dizziness and the headaches and the vertigo, lack of balance, muscle tension. And so they're describing it through a lens of like how is the nervous system and the circulation disorganized? Is everything coming up to the head or is everything going down to the feet? Or there's a couple different other ways to look at it. And so that's the first one of like, how did this experience disrupt and like leave your nervous system, which there's going to be a varying experience for people. And then the other one, which I really like, is all about how shock impacts the way the chi flows in the body. And that's always, well, always 99% of the time. The first treatment that I do when people are ready for needles is it's a way to get rid of the intensity of the surprise element and help people process what they didn't see coming. And so I really like the shock approach, which is a little bit more in the mental emotional school of approach. But that's a lot of what my practice has been is all about musculoskeletal recovery from injury, but how the mind, spirit, and body are all together. And so, how is the mind and the emotions also been disrupted or impacted by the car accident or even a fall? Like, it doesn't have to be a car accident, it can be a mountain biking accident or even just falling down the stairs and getting a concussion. Uh, the things that we don't see coming leave a very different signature on the way that the chi is flowing through the body.
I think that makes sense. If I look back at the people that I've worked on that say, for example, were, I mean, there's a couple of different situations. One, um, just being drunk and getting injured, but also being blackout drunk. And so they wake up injured, but there's absolutely no recollection in terms of how they became injured. And the emotional stamp that leaves in their
Mm-hmm.
nervous system
Yeah.
is really impactful. And then the other situation that comes to mind are assaults that say come out of nowhere, like maybe
Yeah.
they've come from behind.
Yeah. The rear ends. Yeah.
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 So I can see the difference
Mm-hmm.
between the people who saw whatever's going to happen
Yeah.
compared to the people who never saw it coming. And they have to reconcile that they don't know what happened.
Yeah.
That's a big emotional piece.
Yeah, I'd imagine that like the tension patterns that you'd see in bodies that are getting into movement afterwards in what you're doing, Bryn, that the way that people hold their bodies is also really different for like each type of injury experience.
You know what? I'm gonna have to say that I didn't actually look at that perspective, but
Mm.
now that you're pointing it out, when I think back on the people that have been injured, like you said, when they're on the field and they saw someone coming versus somebody who got blindsided, very different reactions, very different emotional management needed with that. And then I find that the ones that got blindsided are more hesitant to return. They're
Yeah.
less confident in their abilities and they don't really want to right away. It's more of that hesitation. So I do
Mhm.
find that they do take a bit longer because they're not ready to
Yeah.
emotionally.
Mhm. And especially when you're doing like a sport or activity that you love, and then something like this happens that you just didn't see coming, and then all of a sudden it's destabilizing to so much more than just your body. It's your mind going like, I do not know how to figure all this out anymore.
Yeah, it is interesting because one of the first things we're taught with concussion or any injury is to make sure that they stick with their team, they stay involved in
Mm.
that emotional aspects or mental capacity within being as involved as they can with things so they don't feel like they've lost it.
Mm.
They lost their team, they've lost their position.
That can be tricky though too, though, like if it's not in an athletic sense,
Mhm.
if it's stepping out of family activities or stepping
Yeah.
out of church activities, stepping out of work. Um, I touch a bit on this um, in the online program, but trying to figure out a new sense of identity and a new sense of community. And I do find like things like acupuncture and what we do and different modalities where you don't have to do a lot of talking. You can show up and the practitioner can then just take it from there. And so I do think that's what our approach in particular um, at least I can speak for the three of us, I think, is that if somebody's not ready to be super verbally expressive, it doesn't change how we're going to work on them. We can do the work anyway. We can chat in a couple of weeks when you're feeling better.
Yeah.
It doesn't change how we're going to work on that person, because we work in just such an intimate way with the people rather than a large place that's really bright and really loud and visually assaulting, and then forcing them to do all this stuff, um, which has its validity, of course, but certainly the container that we're all providing for our people is just a bit of a different experience.
Yeah. Yeah, that sense of safety, I think, is the thing that is lost in so many of those impacts. And it takes a long time to articulate that too. Where, like you can feel your body guarding or not wanting to move or being really jumpy. And there's this like, what's happening? And it's also instinctive, which is great because the body's just trying to click back on to like see the next hit coming, but there isn't one. And so it's a really interesting layer to remove. And I find that if I see people after that initial sort of acute period after their injury, if I see them later, that there's a plateau that they'll have hit, that if we do that little bit of regulating, we can call it, or purging is another way that I think Chinese medicine will verbalize it, of like we're getting rid of that disorganized energy, that they go back to their physios or chiros or different types of modalities, and then all of a sudden they get way more progress. And so the ability for acupuncture to hit the rest stop and the pause button to like refuel and replenish the system helps with all of the more active and challenging. Like you're going to go in and like lift a little bit more weight today, or do a few more reps today, or stretch to a different range of motion today. They're a little bit more active than laying on a table still with needles in them. But that calm period does have an ability to open up different capacity afterwards, which is why I really love working with other practitioners in the right sort of moments and times, and it's a wonderful partnership to have because we all have so many different things that we know that everybody needs at certain moments. And so it's great to be able to have these types of connections and relationships where we can go, oh, hey, you are ready for this next thing. And this is the person that you could think about going to see, or this is the style of treatment that might be really good right now.
Yeah. One thing that I really appreciate about you, Heather, and this is what I explain to some people when they're asking about an acupuncturist, or maybe they're uncomfortable with the idea of like our trigger point and the really more physical stuff, is that you match where the person is at. And so I think whether it doesn't matter if it's me or Bryn or you or somebody else, is allowing the patient to express what it is that they need, and trust that the person who's going to provide the treatment can meet them where they're at. And so I'll say to people, hey, if you want something a bit more trigger point, musculoskeletal, whatever, let her know.
Yeah.
If you want or open to something a little bit more energetic, like meridian based, like let her know. Like she'll go between the two
Yeah.
and match you where you're at. And I don't think every therapist is like that. So I just wanted to, in case anybody in Victoria is listening, just
Yeah.
shout out to Heather.
Yeah, it's the amount of like, because I see people on my calendar. I'm like, okay, these are the people that I know are showing up today. This is what I think I'm going to be doing. And then they show up and I'm like, oh, there goes that treatment plan. That's not where you're at today. For me, it's like super freeing because I do research and and I like go over, oh yeah, I know who's on, like
Yeah.
who I'm gonna see today. And then the second I hit the door, I'm like, we're just gonna like wing it because I
Yeah.
don't know how you're showing up. Because I would say the first years of my career, I was like, okay, I'm gonna do this today, and like we're good because I assume that they're ready. And then I've had people come in wheelchairs where I'm like, well, clearly something's happened in your life.
Yes.
And it's like, oh my God, like I've laughed about it enough times and have been like struggled to pivot enough that I am now so on board with like you show up and I go from where you are because it doesn't matter where I want you to be, it's where you're starting from that really matters. And you know, I like to manage how much discomfort and you know people could call it a flare after treatment of oh I have some soreness and aches. I really try to manage that to not impact somebody for more than a day. Sometimes I miss the mark, but if I don't know, I just think it's more cohesive and integrating for that person to go like, okay, that treatment, I feel that it did something, but it didn't make me have to rest for 3 days. I think that I really like the partnership of having the treatment augment and not need to like drastically change the next 24 to 48 hours of their lives, which I don't know what's going on in them. And so having the treatment be something that's really supportive as a whole for that person is, I think, a really important way to tend the psyche and the experience of the recovery itself too.
I am so happy that you said that because that is how I feel 90% of the time. Where I plan, I'm like, this is your next appointment. This is what we're going to do. You're on that next phase. They walk in and you're like, oh,
Mm-hmm.
no, we're going to put that back away. It's a
Totally.
completely different day.
Yep. It's so
And
funny.
I think it's also really good that we're all so adaptable because, like you said, when somebody comes in with a concussion, and like Jenna said, sometimes they don't know how to say what's going on.
Yeah.
And so instead of us waiting for them to tell us, we just read their body, we assess them and go
Yeah.
with what they need. And I was going to say, a lot of the time, they're like, how did you know that was sore? How did you
Yeah.
know that that was the area I needed something? Because they didn't speak the entire treatment.
Mm-hmm. Yeah, um, the sensory sensitivity. That's a funny way to put it. But I think that over the course of my clinical exposure now, the sensitivity is just there. And it's a wonderful thing to be able to rely on. And I just ask curious questions of like, is anything happening over on the other side of the shoulder? And people are like, yeah, it totally. And I'm like, great, okay. You know, it's just like wanting that inclusion within the treatment. And that's the other really amazing part about acupuncture is that when we treat you, your whole body comes in for treatment. And I know that like maybe it's just your neck or your upper back or your arm that's hurting, but I'm going to treat your whole body because A, it came with you, and B, it's also experiencing the difficulty as a whole. Even though you're not getting any symptoms in your leg, I can still use points on your leg that are meant for your shoulder. And so when things are super acute and people are like, oh, I don't know if I can handle you doing direct work on the area of injury, I can use the whole rest of the body in different ways, which I think leaves so much room to help keep clients comfortable and also include everything in their healing process too.
Yeah, and like in how Brynn and I work, I mean, we're treating the whole body, and how I explain it to people is that I'm like, your concussion is not just your head or your
Yeah.
neck or your jaw. It's your whole body. So we're assessing the whole system.
Yeah.
and treating the whole system um, to help to support the area that we're going to be focusing on. So having said that, like both Bryn and I have, we come from a framework of working with neurological dysfunction, vestibular stuff, spinal, like really just like hands-on, tangible
Mhm.
things. Um, is there something, do you do anything different when you're assessing a concussion, like someone books in and you can see in their intake, well, this is an MVA. Is there a way that you go through that intake process that's different from other people that say, I'm just coming in for my knee pain, or is it the same approach all the way through?
I think it's pretty much the same across the board, especially when people are just getting to know me. And I mean, anybody that shows up in an acupuncturist's office that hasn't had a referral to me or ever had acupuncturist before, I think they're super brave because I do put needles in people. And to let a perfect stranger do that is a big deal. And so I like the process that I have is really like whole life inclusive as well. Of I want to know your thoughts about your injury, I want to know your feelings about your injury, and I think that the time that we have, and I know your treatments are, on the longer side as well, that people don't feel as rushed, and so there's a permission to slow down, which I think is accidentally really, really helpful for concussions in particular, because the world is so fast, that when their head and their whole body is struggling as in that way, there's such a benefit to that slowing down of pace. And then I do hands-on assessment before I do needles, and sometimes treatments are way more hands-on and energetic than needles. Sometimes they're much more needle and resting with the needle focus. And so it does vary a little bit. Then there's cupping and a Chinese massage that also gets sprinkled in here and there. And it just really varies on what the person needs at that time that would be most helpful.
Awesome. Thank you. So, well then, I mean, I guess that takes us through kind of what people would expect from their session. Um, I can speak to the point that I do have a fear of needles, and we both know that there's some points that have been super owie,
Mhm.
um, and you don't push it, which I super appreciate. Uh, but I do say to people, because if as soon as they're like, oh, the people that I tend to refer
Mhm.
to Heather, and I'm sure I've talked to Bryn about this before too, is a lot of emotional dysregulation, anxiety, sometimes more POTS type of symptoms. I find respond really, really nicely to acupuncture, or specifically Heather's acupuncture, because I mean, I couldn't tell you why, but it just is what it is. So I can just tell when I've been working with somebody, I'm like, this, our time is up for now. I think this is the next
Yep.
phase of treatment. And as soon as they mention that they're, well, I don't know about needles, I'm like, well, I'm afraid of needles. I got the special room and the Care Bear sticker COVID situation. So, um, and so I just let people know that it's like it's not what you think it's going to be
No.
when it comes to needles, because they are so small, and because you are very conscious of um paying attention to where somebody's at and their comfortability with the treatment and the willingness to adapt. And
Yeah.
that's the piece that I want people to really take away from, is that
Mhm.
if they've if they have um, stepped into an office to get acupuncture, and that particular individual is maybe not meeting them where they're at, that they could perhaps try a different person, that it's not necessarily
Yeah.
the picture of all acupuncture, because it really does vary.
It really does. Just I think like with all healthcare professions, right? Physios, chiros, massage therapists, acupuncturists, osteos, athletic therapists, kinesiologists, naturopaths, like everybody's a little bit different. And after we have a negative experience where we feel like we couldn't speak up, like that level of hesitation really amplifies the nerves going to see anybody else. And I think you're right of like knowing that when you go in, I know I love it when clients give me direction. Like, tell me that you've got tons of energy today and like, let's really try to get rid of some of this tension. If that's where we're at, okay, let's go. Or they come in and they're like, all I need is like something calming for my system. Let's do that. And for me, the idea and the attitude of more is better is so in opposition to the way that I treat. And for people that really love that forward momentum, I think I frustrate them a little bit at times because I'm like, "Oh, are we trying to drive to Calgary with never stopping for gas?" And they're like, "Yeah. Yeah, I don't want to slow down at all. I just want to get there." And I'm like, "Well, okay, if you don't ever stop, are you going to get there?" And the silence and the like slightly upset sounding like no comes out, and it's like, okay, well, it's not I want you to hang out and never leave this stage of your recovery. It's I want you to slow down a little in order to get back out on that highway and like fly down the road. And so I really like how acupuncture can be still intense and purposeful and effective, but it also simultaneously gives you this like restoration and calming that for me is really critical within every treatment. And so the whole more is better, or if it's uncomfortable and then I say something and it's ignored, I think that practitioners shouldn't do that. Like that's just my stance on it. And because I just think it creates more stress and more tension. And the client that's coming in really doesn't need more of that. And so that's it's definitely my approach of making sure that the comfort and the treatment that I give is able to be received by the body, because otherwise it's like just bouncing off against a guarding layer that isn't going to make any positive changes for the treatment.
Yeah.
Uh, you and Jenna both mentioned where you focus more on musculoskeletal or sport type injuries, as
Mhm.
well as a TCM emotional approach. Can you just explain to people how they're different or how those approaches are different?
Yeah, so for the musculoskeletal approach, it's finding really tight areas of muscle or fascia, and then doing more of a trigger point release, which people may be familiar with of from other people that needle. And so you're getting muscle twitches, and you're probably getting some like deep ache and sensation. The more energetic and mental emotional method of Chinese medicine is way more on the subtle field. And so the energetic, the emotional, the spiritual bodies. Um, and I think going to like wherever someone hurts is what helps direct me from one approach to the other. And I find it's really interesting that my practice is full of like a very physical approach and then also a very subtle body approach. And the amount that they go together is so common that it always makes me question like when practitioners are like, "Oh, I don't really do anything on the mental emotional side." And I'm like, "Wow, I can't get away from it because everybody has feelings about their injury." And I would say many people have feelings that intertwine with the injury. And so the experience of the points that are more for the energetic and emotional side of things are usually a lot less intense. Not always, but less intense. And so it's very often like I put them in and people are like, oh, I didn't even feel that one. Versus the more musculoskeletal approaches, there's an awareness of the point being there.
Yeah,
Jenna notices all of them.
for the most part.
Yeah.
Oh, yeah,
I
yeah.
do too. And I mean, I tell people this and they look at me like I'm a little bit crazy, but I'm hypersensitive to acupuncture. And so I need fewer needles and I need less intensity because my body has had a lot of acupuncture. And so it responds really easily and really quickly. And I think because of my personal experience, it makes me way more um, prepared to support sensitive bodies. And anybody that's in a concussion state is a highly sensitive nervous system. And so I think that that's been really helpful over time just because of my own experiences in how I am able to like soften that approach for others.
Yeah. Well, that's, yeah, that's, I mean, I think we've probably I think we've managed to hit all of the questions that I think we wanted to ask.
I do have one more. Is there
Lovely.
anything that you have people do, like you mentioned, slowing down in their personal life or outside of the treatment to support the concussion recovery?
Yeah, there's and they're not so much Chinese medicine tips, they're more like neurological downregulating tips of just different things to support the nervous system to receive a signal of safety.
Okay.
And so, you know, like coming in to see me once a week, you're getting 1 45-minute session of like safety, safety, safety signaled in through the nervous system and the body. But there's a whole lot of other minutes in the rest of the week. And so there's probably 5 different techniques that I'll give people at varying times. And I sort of gauge for personality type too of like which one will be easier and like have more of an affinity to want to do as well in order to help them in moments of symptoms acting up or stress or anxiety that they can go, oh, if they notice, they can go, oh, I could do this little thing. One of them is brushing. And it's literally just brushing your body for about a minute. Your arms, the area of tension, like just brushing quite vigorously. Yeah, hands on your
Just,
body.
yeah.
Yeah, yeah, just like
Okay.
contact. Because if you do it for about a minute, you'll notice that all of your attention is on your body and in the present moment. So I like to use that one when your sort of mind wanders and you worry, or you have a ton of energy that you can't like express in case like somebody that's a runner and can't run currently, they've got a lot of pent up energy that they like to usually burn off. And so brushing's a really great one to help sort of flood the nervous system with signals of pay attention and like what's going on. And then people will always get that deep breath afterwards of like, oh, okay, what am I doing? And so I like to give little home tips in order to better prepare people for the rest of life that they have to go out and navigate while in a little bit of a um, harder nervous system state.
Thank you for sharing that.
Mhm.
Um, so probably, well, I've got a couple more questions, I suppose. So what I find often with somebody who is peppering their body with every appointment known to man, sometimes that is insurance company or litigation driven. Sometimes it's a type A person who's going to see every therapist they can possibly fit in the week.
Yeah.
My advice to them typically is to wait at least 72 hours between therapies at the minimum. Do you have when someone asks you, okay, so when can I come back, or like when can I see my massage therapist or
Mm.
whatever it might be? Do you have a particular time frame that you mention to people?
Um, Not as a general rule. Like if somebody has more than 3 appointments a week, I always ask them, does this feel like it's now recovering from the treatment? Because usually three, if they're over three, they seem to have surpassed a bit of a threshold, especially if there are two or more hour-long treatments, like for acupuncture or massage or osteo. Um, I actually really like working in close proximity to chiros because if they come in after they've been adjusted, they can get like a really nice ease and a little bit more circulation in those tissues that chiros have probably been, quite vigorous with. But I also don't mind being before them because people come back and they're like, oh my God, my adjustments were like butter. And so there's a really nice ease that can be offered beforehand. So I think it just depends on the treatment modality. And also, I would say that when I know the practitioner and their style, it's a little bit easier for me to gauge how well um, our styles are going to work together. When it's somebody that I don't know, it's a little bit harder. But yeah, it just and the other thing, if the person is highly depleted, like high stress, lots going on with job, family, work, life, injury recovery, uh, making sure that that overtreatment threshold isn't being surpassed is important. So I do try to include and ask about what else is going on for them. And I would say for clients, for them to pay attention to like when it feels more stressful to manage all of the appointments, as well as when their body is just feeling like chronically worked over. There,
Mhm.
those are maybe some signals of like, that's a little bit too much for your system to handle, even if their mind is like, oh, I should be fine. Like it's really about the feedback from the body at that point.
Yeah. Okay. Well, that's good. And Bryn, do you have any other questions?
I don't think I do have any others. I will
Okay.
say that it is easier when I do know what kind of
Yeah.
treatments and the practitioners because then I know how far to push the sessions, where to
Yeah.
back off, what to focus on to really
Yeah.
complement. So it is helpful if I do know them
It
or
is.
we get consent to talk with them to see what their
Yeah.
focus is.
Yeah, and for the practitioners that I work with closely, I send them notes of like, hey, you might want to look here. Like I don't know what they're going to do, and of course they don't have to find anything where I thought that, there was something to look for. But it's really nice when clients come in and they were like, oh, like Cairo said he did this, so this is perfect and like ready for you to work on. So I'll go and look there, right? And see if that sort of I like the partnership of modalities and the network of community that we can create. And so it's such a lovely thing to be able to have that confidence and knowledge of what other modalities and other practitioners bring because we can't do it all ourselves. And I think it's so cool to have the extra resources and knowledge from everybody else that is doing other types of healing.
Yeah. I find too that the clients feel so much more supported and cared for when they know that their therapists are open and willing and having some type of dialogue, whether it's just in the treatment notes
Yeah.
or passing in the hallway or whatever it is. I mean, that's more of an observation. Um, but for those who are lacking community in their experience, when they know that they don't have to over explain, that all the practitioners know what's going on, it just, it, I've noticed that it seems to give them just a sense of ease and their own sense of community within that treatment protocol and that space and time that they're living in. So I think it's really nice that we're in a position that we're able to at least assist in some of that for some of these folks.
Yeah, it's pretty
Yes.
special.
Well, Heather, it was a pleasure having you and hearing your perspective.
Yeah,
And
this
I
was great.
kind of wish that you were on the mainland
I know,
because I'm
right?
also sensitive to acupuncture treatments.
Right. Well, there's people that come from Vancouver and they're like, okay, Heather, I'll see you next month. And
Funny.
so when you find the right people, it's amazing. And those long-lasting connections and the trust that gets built, I think there's nothing better. So,
Heather's my favorite.
no.
So when I move to the mainland, I'm gonna
No.
like putting in my like slotting in my treatment between like my patients, trying to cram it all together
Yes, this whole move to the mainland thing.
eventually.
Yes, I'm glad that it's going to take a lot of time.
Yes.
Yeah. Well,
Yeah.
and it was so nice to connect with you both today. Thank you so much for having me. It's always such a pleasure to talk with other practitioners and hear what you experience in order to help me, like broaden my perspective of what I'm looking for in clients as well. So thank you for that.
Awesome. Thank you.